Good afternoon, and thank you for joining us today. Welcome to our webinar where we will discuss how community-based organizations and urban institutes Year 1 Partnering for Vaccine Equity, or PAVE, cohort overcame barriers to vaccine hesitancy. My name is Rayanne Hawkins, and I'm the co-director of PAVE, where I lead the grant management and technical assistance efforts. Before we get started, I would like to go over a few housekeeping items. Please note that everyone is muted during this webinar. If you have any questions during the presentation, please put them in the Q&A chat box at any time, and we will answer as many of them as we can. Closed captioning is available, and you can open or hide captions using the live transcript button. To follow along with today's presentation in Spanish, click on the interpretation button. There will be a survey link in the thank you email that we send out after the event. We would really appreciate if you could complete it, and because your opinion is really valuable to us. So we are here today to talk about how Urban Institute's Year 1 Partnering for Vaccine Equity grantees were very successful in increasing confidence in getting people vaccinated. There were 3 key strategies that helped influence that success. They were hosting events, training trusted messengers, and developing partnerships. This webinar will start with a presentation about PAVE as a project and the community-based organizations that were the grantees, move on to a panel discussion where representatives from 2 community-based organizations will talk about their work. And finally, we will leave a few minutes at the end for questions and answers with our panelists. Now, I'd like to introduce my colleagues running today's presentation. Annie Heinrichs is a policy analyst in Urban's Research to Action Lab. In this project, she is one of 2 grant managers. She is joined today by Amaya Taylor, who is a policy assistant in the Research to Action Lab. Amaya supports the project's technical assistance and grant management work streams. Both Annie and Amaya are co-authors of the forthcoming Year 1 evaluation report on which this presentation is based. I will now turn it over to Annie to start the presentation.
Thank you so much, Rayanne, and I want to reiterate a big thank you for all of you being here with us today. We are looking forward to highlighting the impact and lessons learned from Year 1 of the Partnering for Vaccine Equity program. In today's session, we will share information about the Partnering for Vaccine Equity program, otherwise known as PAVE, and explain the challenges and barriers community-based organizations have faced during program implementation, as well as discuss promising practices to address vaccine equity. To kick us off, I will pass it over to Amaya to provide a brief project overview.
Partnering for Vaccine, thank you, Annie, I appreciate it. Partnering for Vaccine Equity, otherwise known as PAVE, is a program launched with support from the Centers for Disease Control and Prevention. It was created as an investment in vaccine equity and an opportunity to build knowledge and evidence on effectively increasing vaccine coverage for both the current moment and future vaccination efforts. The CDC conceptualized the Partnering for Vaccine Equity program in 2019. The program was then launched in 2020 to increase equity in adult immunization, particularly for COVID-19 and influenza. Part of larger health equity effort recognized that many factors create health barriers for people of color. The factors are social, geographic, political, economic, and environmental. In the first year of the program, the CDC provided over $156 million in funding and support to more than 500 national, state, and community organizations. The Urban Institute became one of the intermediaries to channel this funding to support local organizations doing the work on the ground. The Urban Institute had the opportunity to support these community-based organizations in 2 ways. One role was managing the learning community, and the other was serving as an intermediary through grants management and technical assistance. For today's presentation, we will be focusing on our work as an intermediary and the lessons learned from our CBOs. In total, the Urban Institute supported 29 community-based organizations, or otherwise known as CBOs. They are located throughout the United States. Organizations participating in this cohort were located in states including California, Colorado, Texas, Louisiana, and others that are highlighted on the map. 83% of the CBOs were federally qualified health centers. 14% of CBOs were other nonprofits, and 3% of CBOs were community health centers that were non-federally qualified. The cohort of 29 community-based organizations was a product of two application processes that commenced in April 2021. After the first cohort was selected in June 2021, the Urban Institute and the CDC sought to respond to the increase in COVID rates and vaccine disparities that heavily impacted communities of color. They opened the opportunity to organizations serving communities in Louisiana, Alabama, and Mississippi. A specific element of the project was to increase vaccine uptake in communities of color. The table on the left-hand side highlights the percentage of urban-funded community-based organizations serving each of the races and ethnicities listed. 90% of the 29 CBOs serve communities that included people who are Black or African American. 86% serve communities that identified as Hispanic, Latinx. 14% serve communities that identified as American Indian and Alaskan Native, and 41% of the communities serve communities that identified as Asian American and Pacific Islander. Since the CBOs serve more than one ethnic group, the percentages you'll see will total more than 100%. And to further illustrate the commitment to serving populations of color, we also wanted to note that over 30 languages were represented. And these languages were used to develop a number of communication products. And that number of communication products, which totaled 13,916, is just one way we were able to understand our impact quantitatively. This number, among others illustrated on this table, are a reflection of the impact the urban cohort had during year one. Other impact indicators show in total that the 29 organizations trained over 77 trusted messengers. They held over 1,000 events and fostered 481 partnerships made to promote vaccine confidence. And they also developed 167 partnerships that they developed with vaccine providers. The great work of this team of 29 community-based organizations led to an accumulation of more than 105,000 influenza and COVID vaccines administered during the first year of the PAVE program. Now, I'm going to turn this over to Annie to talk about what this means in practice.
Thank you, Maya. I get goosebumps, I think, every time that we talk about this 105,000 number. It's a lot of shots in arms. And with that came a lot of lessons learned. So the lessons we're learning that we're sharing with you are based on monthly performance reports that were submitted by our community-based organizations to the CDC. Although there were many challenges and barriers that were unique to communities, there were 4 that consistently impacted all of the community-based organizations we worked with. These were mistrust of government institutions and medical establishments, access to vaccines, misinformation and myths, and social determinants of health. Let's dive into each of these a little bit more. CBOs reported that community members lacked trust in government and other traditional institutions that have historically failed to take care of them or have actively harmed them due to systemic racism. Among certain refugee, immigrant, and migrant populations, there was also distrust in mainstream Western medicine, including vaccination. For some, accessing vaccination was simply too inconvenient, time-consuming, and burdensome. In many communities, opportunities to get vaccinated did not accommodate long work schedules or non-traditional work schedules, lack of paid time off, proximity to communities in need or adjacent to public transportation, or the need for childcare, both during the vaccination itself, as well as the onset of side effects. Information, misinformation, and myths was one of the most prevalent challenges that we faced in year one. Misleading stories and lies spread fast in social media and by word of mouth. And since these were shared by friends, family, and community members, they were often trusted more than messages from the public health officials and other formal authority figures. The most common piece of misinformation were that the vaccines caused infertility, that vaccines simply did not work since breakthrough cases were still happening, and that side effects of the vaccines were worse than the virus itself. Many also believed that the vaccines cost money, were only available with insurance, or required proof of immigration status. We also heard many myths that diminished over the course of this project, such as the vaccines had a chip for tracking, and that the vaccines would actually worsen pre-existing conditions. I'm so sorry. Additionally, many people lacked access to scientifically accurate information about the vaccines and the virus itself. This resulted in a lack of awareness and understanding of the risks and the scientific evidence to back them up. The majority of readily available information from official sources about COVID-19 and vaccines were typically not presented in a culturally competent form and/or were not in the languages spoken by the target populations. That being said, even when information was provided in different languages, illiteracy or limited levels of literacy limited access. Similarly, access to and familiarity with technology was a barrier. For example, the use of QR codes, which I think became very popular for all of us in the pandemic, really fell on struggling communities and were hard in communities where smartphones and or internet access was limited. And lastly, social determinants of health. In many, if not all communities, the organizations that we worked with, access to economic opportunities, healthy food, physical activity, clean air, reliable transportation, and safety were scarce due to systemic racism and other factors. It is well documented that social determinants such as these play a large role in overall health equity, and in the case of this grant, access to and interest in vaccines. When community members are worried about feeding their children, obtaining stable housing, or making sure they have gainful employment, getting vaccinated is sometimes not the immediate priority. To combat these challenges and barriers, there were 3 promising practices that emerged. These included building strong community partnerships, hosting community-focused events, and engaging trusted messengers. Building strategic partnerships was crucial in gaining community trust and reaching more people. For example, Mississippi Immigrants' Rights Alliance, also known as MIRA, in Jackson, Mississippi, created strategic partnerships with faith leaders throughout Mississippi to increase vaccine confidence and set up vaccination sites where people felt safe and comfortable. Hosting events that were convenient to community members and in a safe space for them also had great results in getting people vaccinated. For example, Arab American Family Support Center in Bronx, New York, used community center space attached to a local mosque to host vaccine events following services. They worked closely with the imam to encourage people to visit the event and staffed the event with Arabic speakers to provide information, address concerns, and support individuals through the vaccination process, whether they got vaccinated that day or later on. And lastly, engaging trusted messengers. Engaging trusted messengers has been a widely adopted promising practice amongst our CBOs through ambassadorship programs, promotoras programs, and in other informal ways. Eden Youth and Family Center in Hayward, California created a promotoras program with trusted messengers from the community for the community. Using intentional one-on-one conversations, they educate and support a person through their own unique vaccination journey. Looking forward to this next year that we're currently in. So we are in year 2 of the program and currently supporting 28 community-based organizations developing capacity to implement these promising practices. We are also wonderfully expanding the program to promote equity across all recommended adult vaccines by the CDC by providing supplemental funding to some community-based organizations that we are working with. Lastly, we look forward to an ongoing partnership with the CDC in year 3. I am thrilled that 2 of our organizations that were a part of this impact in year 1 and are still with us in year 2 are here to share more about the lessons they learned and what it means for their work and potentially yours. And with that, I will pass it along over to Rayanne.
Thank you, Annie. I'll now invite my fellow panelists to come on screen and unmute themselves. So we just learned about 3 effective strategies or promising practices for increasing vaccine confidence and equity that include partnering with other organizations, hosting events that aren't focused solely on vaccination, and training trusted messengers. As we begin the panel section of today's webinar, we will discuss these strategies in greater detail. And for those of you who didn't see in the chat, bios for today's speakers will be available online. And so I'm going to give a very brief introduction to each of my speakers today. I'm delighted to be joined today by Karen Halfin, who is the Executive Director of the Eden Youth and Family Center, and Luis Espinoza, who works in community engagement and is the lead organizer at the Mississippi Immigrant Rights Alliance, or MIRA. As Annie mentioned, both of these organizations received funding from Urban during the year 1 and are continuing on with us in year 2, as well as were highlighted previously in the presentation slides. So we learned from Annie that there were 4 common barriers to vaccination across all of Urban's grantees. This first question is directed to Karen. What was the most common barrier to vaccination in your community, and what did you do to address it?
Thank you, Ryan. So there was a lot of confusion and fear of providing what people thought was required information like an ID, something that might identify them and their immigration status. So they were scared that their immigration status would be reported to ICE. And how we overcame that was we just explained the process to them, and we showed them, this is the information that will be requested at the time of sign up. There won't be any questions about insurance or anything else like that. It was really your name, phone number, email address, so that they could be contacted in the future should they, for contact tracing and things like that. But really, that was it, other than demographic information. So so that's really how we overcame that, was just by educating them, and it put them at ease.
That's great to hear, because we know that misinformation was one of the big reasons people weren't getting vaccinated, and immigration status was one of those key myths that you had to be a citizen to get the vaccine. I will now pose the same question to Luis. What barriers were most common in your community, and what did you do to overcome them?
Thank you. Yes, let me start saying that the barriers has been changing according to the time that has passed. When we start, we had different kind of barriers. The vaccine was, when the vaccine was available, many theories already have been around us. So we had to fight and start to talk about what really are those theories. And because sometimes even the health authorities send misinformation. As became global pandemic, we were all confused and we didn't know what to believe. And I think never, all this generation never has been so confused. Now, talking about this community here in Mississippi, when the vaccines were available to everybody, we began to realize that people were scared about going forward to receive the vaccine. Why? Because many of those vaccination campaigns were being organized with the presence of the local police and national guards. So we at MIRA, what we did is we began to organize events without the presence of the police authorities, and only go with the support of the community and religious leaders. So that is the way and then now we are with different kind of situation, is because the people believe they don't need it. That is the major barrier. They say, okay, I already have the vaccine, I already had the COVID, so I don't need it because I'm feel good, so I don't need anymore. That is what we see about this point.
Yeah, I think it'll be interesting when we get to the year 2 evaluation report, when we talk about COVID fatigue, because what you're just mentioning is all about the fact that a lot of people either had COVID or already got the first 2 shots and think they don't need to worry about COVID anymore, and that it's just kind of going away.
Yeah, and because you have to, we have to remember, because it's so new for everybody, the information, really hard to get the information in Spanish. And then some people, we serve some people who even maybe do not read in Spanish, or they need to have information in the different dialects, especially mom from the Guatemalan communities.
Yeah, it was really great earlier in the presentation when we learned about all of the various languages that our 29 CBOs served. And I think a lot of information was translated one-on-one verbally, which is really great.
Yes.
So my next question is for Luis. What partnerships were the most valuable for getting community members vaccinated in this first year of the grant?
Well, we try to find the better partnerships we can find it. And we get lucky because we already know many organizations in the community, leaders, different kind of leaders, and the priests, different leaders, religious leaders, and they were very open to help us for one side. Another side, we find organizations similar like us with a good service about medical services. So all together, we put everything together and we can get a very good information, and we get a very nice results with the way we handle these partnerships. Also, the pastors has helped us to a great deal, advising the people to get vaccinated and take advantage of the fact that we have been giving them at home. Let me tell you this, one comment was very interesting for me. One of the priests who told the congregation when we announcing that we will be providing the vaccine against the COVID, what he says is, you have to see here in this country, we are getting at home for free something in our countries maybe they cannot get, even they have to pay it. So that make me the idea of they really see in us what we're trying to show to the community. We are there for help and give them help.
Yeah, that's interesting how they highlighted the value of the vaccine itself and how lucky and fortunate we are to be living in the United States where we can get it for free.
Yes.
So my next question is for Karen. Can you talk about an event that you hosted that wasn't focused on COVID and explain how you engaged with people getting vaccinated?
Sure, thank you. So Eden Youth and Family Center has an annual backpack event. And in 2020, we knew that students were going to be working virtually from home, right? Attending school virtually. And so that backpack event had to look a little different, right? And as a matter of fact, we didn't really distribute backpacks per se. We really distributed school supplies, and we took the community's advice, engaged with schools, what are they really going to need, and then collected donations and things like that. So we partnered with many individuals in the community to make sure that students would have what they needed. And the backpack drive was a drive-through rather than, a huge event that would have lots of tabling and things like that. So we partnered with an organization locally that did mobile vaccinations. And so we had a mobile vaccine clinic at the back of the event. So it wasn't front and center. Everybody was there for school supplies, but we added them in the back because we had a captive audience. It was so hard at that time to engage with people, right? Everyone was in their homes, in their cars. They weren't going anywhere. We also engaged with the sheriff's department to provide some recreation games and things like that. So our promotoras do what they do best, and they work the line. So as people were in line waiting for their school supplies, they talked to individuals and adults and about, about getting vaccinated and what their status was at the current time, et cetera, et cetera. And so for those who wished to be vaccinated, we had them turn into a separate area in the parking lot, go back near that mobile vaccination clinic, and they got vaccinated. And their children, while they were getting in line and getting vaccinated and doing the waiting period, we had partnered with the sheriff's department to come out and bring their recreation activities so that the children could play and be safe while their parents were getting their vaccination. So that proved to be really, really successful. And we did that at a few more events that we had when we were able to. So, so yeah, all about partnerships, all about seizing the moment when people were there, which again, at this point is not so difficult. It's not as much of a challenge, but back then we really had to get creative.
Yeah, that sounds like was a really successful event. And I like the fact that it focused on some of the social determinants of health, like access to healthcare, education for the children through like the school supplies, and also safe kind of childcare with the games that distracted the children. So that kind of deals with economic stability and inclusion, which is really cool. And sometimes a barrier to vaccination itself too.
Yeah.
So this next question is for both of you. What qualities do you look for when finding or recruiting a health ambassador or a trusted messenger? And I think, Luis, you can go first this time.
Thank you. Yes, the qualities we look for health ambassadors, trusted messengers, are those qualities that are accepted by the community, their groups. As the word says, they have to be trusted. The community listen to them, believe them, and we know that the community, there is different sectors and characteristics. That's why we try to find ambassadors who can better connect with certain group of people. We're looking for leaders already known by the people, men, women, young college students, leaders of sport groups. And the main characteristic for us is that we are looking for is these future ambassadors. They feel and they want to be part of this important campaign of being health ambassadors. So they have to really know and feel it, and they can feel how important it is to be an ambassador, health ambassador. And to tell you the truth, this is often the hardest thing to do, to find it.
So Karen, you also have a Promotora program. Do you want to talk a little bit about how you guys did your recruiting?
Sure. So we have a local medical clinic, actually numerous medical clinics under this organization. And so we knew that there were these trusted messengers out in the community, and we knew we needed to find someone whose face was recognizable, who was, people just like the people in our community, right? Someone just like them. And so there was this group of, they were either volunteers or part-time promotors for that health center. And they, at that point, were making a small stipend. So I approached the coordinator because I wanted to make sure that, she didn't feel like I was stealing her promotores or anything like that, right? So I coordinated with her, and she and I are good colleagues and friends. So we talked about the program, expressed our need, and we collaborated for recruitment. And first we started with one, and then, you know, as we grew, we needed others. And so we really looked at the promotores network, their individuals network, because our first promotora, she was like, this person would fit in well with what we're doing. This person would, the next person would add this component to what they're doing. And so, and then finally, we have someone who's very tech savvy and great out in the community as well. And so we had a kind of a really well-rounded team. It's well balanced. They're different ages, ranging from mid-20s to mid-50s. And so they just kind of gel and it works. And I feel like they were hand selected, not by me, the first one, but from there it just grew, and it's a beautiful thing. I'm really, really blessed.
Thank you, Karen. It sounds like from both of your organizations that there is this focus that it doesn't actually matter a person's kind of age. It really matters a little bit more on their sphere of influence and the people that they hang out with, and whether or not the people that are around them look to them and look up to them. And so I think it's really interesting that a trusted messenger can be various different ages, as long as they're really looked up to and passionate about health.
Yes.
Yes.
So thinking back to the beginning of the pandemic, this question is for both of you. When this project launched, we talked a little bit about the myth related to vaccine immigration status, but what other myths were common in your community, and what did you do to address them?
Karen?
I think I'll go ahead and go first, if that's all right.
Yeah.
Okay. So one of the things that we found just immediately was, you know, the myth on infertility. And so we had to really study and understand, because we couldn't just say, oh, it doesn't affect that. You know, and there were a lot of people that were saying, well, the vaccine came out so fast and it hasn't been tested and blah, blah, blah. And we're like, no, we really need to arm ourselves with information. And it took a little bit of time because we wanted to make sure we had clear, concise messaging. We don't want to kind of go all over the map, because that's when you lose people, right? So we just explained that the truth is that the vaccine teaches the body's immune system to fight the virus. So, you know, that by getting the virus, you're actually helping your body, you know, to fight off COVID-19, should you experience that during a pregnancy or getting, you know, trying to get pregnant. And also, you know, we learned that the unvaccinated individuals could have serious impact on pregnancy and other health issues. And so, you know, talking to individuals about that really helped. They're like, oh, wait a minute, you know, I could be doing something to, you know, my unborn child, and I could have longer effects. And so, yeah, that was one of the main things that we ran up against. And you could just see their just true concern, which was why we took a while to make sure that we understood and could have something that was very clear and meaningful.
Yeah, talking about what happened when everything started. Many of those myths already are gone. Really, it's more like now is about that the people is tired about the vaccine, about talking about the COVID. Like I said before, so what now for us, we're trying to do now is go with a different tactic. We try to make from time to time videos. We place those videos on our platforms, Facebook, YouTube, and we have a contact with doctors, and we can start to answer the questions the people send to us and tell the doctor to explain. So we had some a good number of people who has been vaccinated after they talking with the doctor through these programs. It's right now is hard to understand because it's not like a myth anymore. I think it's just a few myths. More is like I said before, the people is tired. They say, I don't want to because I feel good. So what we try to do is make a follow-up. We have the data, start to make phone calls and tell them, please, you have to get the booster and give information or ask them why you don't want to be get the booster. So we get that information and trying to explain them what the reasons we have for them to get vaccinated.
And are you finding, Luis, that people know about the updated booster or the bivalent booster in your community?
Yes, definitely yes. They know about that. They know, but they don't want to get vaccinated. They say, no, I don't need it. So that's why it's right now, for me, the first year, the first times, months, it was not too difficult to make the people get vaccinated. Now is when we really have to start to work harder to make that person to get the booster, explain them, find a way they can accept to what they need to do.
So I think one of the questions that came in from the audience is about vaccine hesitancy and what various tactics are each of your organizations doing to promote and continue to promote COVID vaccination as this public health emergency ends. And I know, like Luis, you talked a little bit about this in your, just previously when you were talking about getting the doctors to talk, but maybe you can talk a little bit more about what you did on social media.
Yeah, we try to explain, even if we get some information on some questions. So we place those questions with the answers in our Facebook, YouTube, make pamphlets, flyers, and distribute in the different cities. We cover different cities around central Mississippi and South Mississippi. So we try to give the information. For me, is the most important is because why they don't want to get the vaccine, because they don't have the good information. So our effort is to give that information, understand, listen. Do not try to convince by imposing the ideas and arguments, but accept that everybody is tired about this topic, but what we need to do is remain alert. One of the advice we gave to them is, remember, winter is coming, so better you be prepared. Make them feel like it's not only because it's because your family, your kids, your mother, your father, the whole community. So it's not only about you, please. It's about the whole community. So that is the way we try to approach and reach the community.
I like that approach of using both social media to answer questions that people have and also really relying on people's strength and connection to their community and wanting to do what's best for the community.
Yes.
I'll pose the same question to Karen. So what new tactics are you doing at Eden Youth and Family Center to try and encourage people to get vaccinated, even though everyone seems to think the public health emergency has ended or is ending?
Well, we're doing more events, but I won't touch on that because we've already talked about that. But, we are canvassing neighborhoods. We have feet on the ground, walking neighborhoods. We have 2 promotores with each other, right? Never go out alone. And they are just pounding the pavement, and they have created little brochures, and they change them. Or initially they were changing them weekly, right? Because the information was changing and messaging was changing. And so, and now they are doing every other week, or when something changes, they'll, make a new flyer and attach it to doorknobs. talk to people where people gather, right? At the grocery store, the food pantries. One of our promotoras knew of several places where they did Zumba. And so they would go and give flyers out there, have it, you know, they had signage, right? And they did that for like a week, and then they come back, 2 days a week, and then they come back in another month and do it again, right? So to try and capture different times and different people, and that worked really, really well. You know, trying to go where people gather. At the beginning, it's hard, but now it's much easier. But those one-on-one conversations are just the key. It's the secret sauce to what we're doing, right? So even when we're doing outreach at community events or outreach in the community, if we'll say, if somebody's, you know, that's loud around and they can't really hear or whatever, we have one person working the crowd and we have one person sitting at a table, if you will, with 2 chairs. And so one of the promoters will bring someone, you know, an individual over, and they can have a one-on-one discussion off to the side privately, right, to discuss the vaccines, to discuss the boosters, et cetera, answer any questions. So it's more intimate, right? Which I think is really important, especially when you have a trusted messenger. They're more comfortable to sit down and talk with you.
Yeah, let me add this, because what I think is very important is to make the people, the community, feel that we are there for them, to help them, not only because the vaccine, but we try to make them to prevent illness, prevent disease. So we can add to our vaccination events the extra services like basic health screenings, like glucose tests, blood pressure, give flyers, pamphlets about any different kind of issues like diabetes, blood pressure, so that they feel like, okay, this organization, they try to help us and to have a very healthy life. In that way, they are positive about what we are doing. And then we must have a contact with the people who already have vaccinated in our database and be in contact with them, advise them, and ask them questions.
I think the overall theme is kind of twofold. It's meet people where they are, like whether that's at an event or whether that's coming into the doors of MIRA for other health services. And that those one-on-one conversations are really, really critical, because people want to know that it's okay to get the vaccine, that someone else has gotten the vaccine, and that they're doing okay, especially I think when everything was so new and everyone was so concerned about how quickly the vaccine was developed. So now we'll turn to some questions from the audience. This question is for both of you. What advice do you have for other CBOs that want to improve vaccine equity in their communities? And Karen, you can go first.
So I'm just trying to think through this one. I apologize, but you know, if the biggest advice I can give is make sure that your staff is really well informed and try and get ahead. It's just hard, very difficult, but you know, and to really just be comfortable about talking about the vaccine. You know, if you're hesitant, others are going to be hesitant. So kind of role playing with each other to talk about, you know, what does that look like? What might others' questions might be, and how do you combat those questions? You know, I think that those are the things that if I were, you know, recommending to another CBO, just based on our approach, you know, those things really work for us. It's really making sure that we could maybe anticipate those questions so that, you know, we could answer them. Also, let me get your contact information. Let's talk more about this. I'm happy to call you and follow up. And from there, we did we scheduled appointments. We made sure that they had rides to their vaccination clinics. It was just, going above and beyond to make it easy for them and holding their hand. I had an employee take someone to get their vaccination. She went with her. The woman was scared, so she went with her. And it's one of those things. We don't do that for everybody, but yeah, you do what you can do.
Yeah, for me, it's basically number one, being in contact with the community. Always be in contact, not just forget about it. You get a vaccine and that's it. And then be updated. Have the information, receive the information from the government, from Urban. You have a lot of good information. So we get that information, we can spread to the people. Always use what you have to improve your services.
And that actually leads really well to leads really well to this other question that just popped up. It says, what kind of training or education do you provide to your ambassadors or promotoras? And you were just talking about how staying current with all the information is really important. How do you relay that information to those workers and ambassadors?
Yeah, so we actually, so we get a newsletter every week, but then we also go out to the CDC site, and we're just trying to be as hungry as we can for information. So I have my promotoras, and then I have Eric, who supervises the promotoras. And so he would go out and get information from the CDC site. There are trainings out there. There's a lot of information out there. And so we'll do like 1 a week or 2 a week. When it was, when it's raining like it is here right now, we'll spend more time in the office because we can't be out in the community. So it's taking those opportunities. But the initial training was really one promotora sitting down with another promotora and talking through it, and then again, being hungry for information. That was, should have mentioned that earlier about recruiting. I wanted to find someone that was curious. We wanted people that were not just, that we didn't just need to give them the information, that they were curious and wanted to find answers out for people. So yeah, I mean, that's not in great detail, but from a training perspective, that's what we did. Yeah. And we thank Urban and we thank the CDC for all the information that you've provided us. That we have nothing but wonderful things to say about the partnerships that we have here in this room.
Yes, I agree completely. Yeah, because is the only thing we have to do really is to pick up, get the information and give it to the promotoras. And even I learned something. Even I like to ask to any ambassador, okay, why you are here? Why you decide to help us? Because that information maybe can help us to get more people about that. Yeah, so why? Because you like it, because you love the community, because maybe you have somebody who died because the COVID, so you don't want it happen to somebody else. That information is what we have to put in the paper, give the information, and they can spread the word.
Really like what both of you have said there. One, making sure that you are up to date on all the resources and staying up to date and sharing that information with your various health workers and also with the community that you serve at large. And looking for people who are curious, who really care about like health and are interested in why other people may be hesitant and really have that curiosity and connection to other people, I think is very important. And so thinking back to a previous question, we talked a little bit about those qualities that are in the community healthcare workers or promotoras or ambassadors. What kind of work do they do outside of the events that we've already talked about?
I don't understand.
So we talked about having one-on-one conversations and attending events, and we talked a little bit about training. Are there other things that the health ambassadors do for your organization?
In my case, no.
In my case, we not only discuss and share information about COVID, but we also share information about, I believe Luis did this earlier, about other resources in the community, resources that we have at our center, because our center is a community center, right? And so we have a health center, a clinic on site, we have childcare on site, et cetera, et cetera. And then we have our close, network of partners. And so we have created, one sheet, English on one side, Spanish on the other, just quick resources. And that really helps, so they create that information and share it, and then they draw on those partners. So when they're working with us, they're really promoting our programs, they're promoting the programs of others, and our partners have seen an uptick, right, in their referrals, and have made mention, wow, we heard that Leticia got, spoke with this person and she referred them to us, or we'll do warm handoffs, right? And again, it goes back to caring for the community. So yeah, it's around community, it's around COVID, and it's around supporting families. And I think I heard Luis said the exact same thing earlier.
Yeah, I have a question. I don't know if it's okay, but that means that your promoters and ambassadors, they work with you full time?
Yes.
Okay. Yeah, that is the difference.
Yeah, they do check-ins every morning and discuss what their plans are for the day. They wrap up their day with the lessons learned, all with their supervisors, and then they spend about an hour and a half to 2 hours just prepping for the day, creating new materials, that sort of thing. So,
okay,
yeah.
So both of your organizations are nonprofits. What motivated you to want to take on this work? And I'll start with Luis.
Talking about me personally or the organization?
Mira, why did Mira want to do this work?
Okay, yeah, what happened, let me tell you about Mira. Maybe many of the people who is in this webinar do not know about Mira. Mira is an organization 20 years old, and most of the time we work is helping the community, immigrant community, is Mississippi Immigrants' Rights Alliance. And we go to give education about their rights the immigrants have here in this country, especially Mississippi. But we had a really big raid here 2 years ago. And when we finished, we're trying to help those 680 people who get in cancer, had the rates. Just after that is when the COVID came out. And we can see our community, they already suffer for almost 1 year because the rates, and they cannot work, and they had a lot of necessities. And immediately came the COVID. So we saw we cannot just work about the social issues, but right now they need our community need us in these health issues. So that's why we start to work with you, with the health department, to try to help the community in this situation. And we are happy because the people, we cannot talk about rights, we cannot talk about jobs if the people do not have health, if they are sick. So that's what we try to do.
That's great. I really like that theme of social determinants of health, and how you were already providing some services, but that needing to help people be well and overcome COVID was just a natural fit. So Karen, I'll pose this question to you. This is the last question, which is the same one.
So, well, Eden Youth and Family Center, let's see, we were founded in 1977. So we've been around for a long time. we serve a community that is 54+% Latinx. So everything that we do is through an equity lens. That's who we are, what we're focused on. And so we really want to, we have substance use programs, substance use prevention programs, all about health, mostly around prevention for youth, or accessibility for youth to have access to substances. But we also have a parent component. And so we do parent workshops and that sort of work. And it just fit in nicely. We had an outreach team, and they weren't promotoras, but now they're kind of all working together on events and things like that. And you know, it's been it felt like the right fit for us. We explored it further. I'm an executive director that I really don't like mission creep. Here's who we are. This is what's at our core. And yes, there's other funding out there to do this and this, but that's not who we are. You know, and that has really helped us from a capacity building standpoint, because we didn't have that focus. But again, equity is who we're about. And so when this opportunity came about, I was like, this is what I want to do. And I talked to my staff, because we're very close. We're like family, and like, what do you think? And they were like, yes, this is what we want to do. Here's how we can help through this pandemic.
Yeah.
Because we're in a health clinic, right? There were so many obvious things that organizations fit into, but when it came to what we do at our core, it wasn't as obvious until we saw this opportunity through Urban. And again, very, very grateful.
We're grateful for the partnership as well. Without both of your organizations on the ground doing the actual work, we wouldn't have over 105,000 shots in arms last year. So it's really, really kudos to both of your organizations, and also to the other 27 organizations that were part of that same cohort of grantees for PAVE. So I want to thank everyone today for joining us. It's been a wonderful webinar, and I have a couple key takeaways I'd like to share with the audience as we close. So we heard a little bit about some of the myths and some of the barriers to vaccination, and they were, you know, distrust of the vaccine, lack of access to the vaccines themselves, misinformation, you have to be a citizen, or the vaccine causes infertility, or other social determinants of health, as in people needed to have access to transportation or childcare, or their own job didn't really have the right kind of timing to allow them to go. And so we heard today about the 3 strategies and promising practices that the first year of Urban's PAVE grantees implemented. And once again, those 3 strategies were partnering with organizations to increase vaccine competence and improve rates, hosting or co-hosting events that are not explicitly related to COVID or influenza. We heard a little bit about Karen's backpack event that really gave out some school supplies, but also helped get people vaccinated. And we also heard about who people trust with health information varies by community, and that training trusted messengers is a way for community members to look and see someone who looks like them, or sounds like them, or is like them, and can meet them where they are to share vaccination experiences and dispel myths. And, you know, in some cases that might be partnering with a religious organization like Mira did. But overall, it's been wonderful to work with both of your organizations. And I want to thank you for joining us.
Thank you.
Thank you for the opportunity.
We really appreciate all the audience members who joined today too. And if you get a moment, please fill out the survey that we just put into the chat. And with that, I will close out our webinar. Thank you, everybody.
Thank you.